Pupillary reflex. In this video, we will learn about the importance of pupillary reflex pathway, assessment of the pupils, how to elicit direct light reflex and indirect light reflex. Pupils. It is an aperture present in the center of the iris. The size of the pupil regulates the amount of light reaching the retina, controls the amount of chromatic and spherical aberrations. The pupil size is controlled by the dilator and sphincter muscles of the iris. Size. Normal pupil size varies from 2.5 to 4 mm depending upon the illumination. Myotic pupils are less than 2 mm. Mydriatic pupils are greater than 7 mm. Diameter of the pupil size should be estimated in light using either normal room light or a handheld transilluminator. Significance of pupillary reflex. Pupillary assessment is an important part of neurological assessment because changes in the size, equality, and reactivity of the pupils can provide vital diagnostic information in the critically ill patient. Pupillary light reflex is used to assess the brain stem function. Abnormal pupillary light reflex can be found in optic nerve injury, oculomotor nerve damage, brainstem lesions such as tumors, and medications like barbiturates. Now let us go into the pupillary reflex pathway.
In the figure you can see the light rays entering through the pupil. Pupil is an opening located in the center of the iris of the eye that allows light to strike the retina. The light reflex is initiated from the rods and cones throughout the retina. The fibers run up the optic nerve, partially decussate in the chiasma, and enter the optic tract with exactly the same distribution as the visual fibers. Near the upper end of the tract, however, they part company with the visual fibers, and instead of running to the lateral geniculate body, they enter the pretectal region. Here, they are relayed in a small pretectal nucleus of the same side. These fibers that are running from the retina to the pretectal nucleus constitute the afferent fibers of the pathway of light reflex. Now, the internuncial fibers, that is, connecting fibers, connect each pretectal nucleus with Edinger-Westphal nuclei of both sides. This connection forms the basis of consensual light reflex. The efferent pathway consists of the parasympathetic fibers which arise from Edinger-Westphal nucleus in the midbrain and travel along the third cranial nerve, that is the oculomotor nerve, to reach the ciliary ganglion to relay. The inferior division of the oculomotor nerve constitutes the preganglionic fibers, and the postganglionic fibers travel along the short ciliary nerves to innervate the sphincter pupillae, resulting in the constriction of pupil. So what does light reflex mean? It means that when light is shown in one eye, both the pupils constrict. There are two types of light reflex: direct light reflex and consensual or indirect light reflex. Here the light is being shown to the left eye, and the afferent fibers carry the impulses from the retina to the optic nerve through the optic chiasm and the optic tract. These form the afferent fibers and they reach the pretectal nucleus, and from there the internuncial fibers arise and end in the Edinger-Westphal nucleus, and then the preganglionic fibers arise and they end in the ciliary ganglion. Then the postganglionic fibers arise and end in the sphincter of iris, resulting in the constriction of the pupil. Here, both the direct and the indirect light reflex or the consensual light reflex are positive. Why? Because the constriction of the pupil to which the light is shown is called the direct light reflex, and that of the other pupil is called the consensual or the indirect light reflex. In this case, when the light was shown to the left eye, the pupil of the left eye constricted, leading to a positive direct light reflex, and the pupil of the right eye constricted when the light was being shown to the left eye, leading to a positive indirect or the consensual light reflex.
I'm going to elicit pupillary reflex on this patient. Before eliciting pupillary reflex, you have to introduce yourself to the patient, explain the procedure to the patient, and get consent. Hi, my name is Shambhupriya. I'm going to examine your eye. At any point, if you feel any discomfort, please let me know. Ideally, pupillary reflex should be done in a dim light. The patient should be seated in an upright position, and the patient should look at a distant object. The examination should be done at the level of the patient. You should not stand in front of the patient. If you stand in front of the patient, it will cause miosis and accommodation, and your inference will be incorrect. You should look for the size, shape, and position of the pupil. Ideally, you should not shine the torchlight directly on the pupil. You should shine the torch from the side of the eye to be examined. reaction has two parts, direct light reflex and consensual light reflex. First, you have to elicit direct light reflex before eliciting consensual light reflex. For eliciting consensual light reflex, you need two torches. First torch is to elicit direct light reflex. Second torch is to compare the other eye for eliciting direct light reflex. Torch should be the ideal source of light and it should be of appropriate brightness. It should not be too bright or too dull. Now I am going to elicit direct light reflex. Before eliciting the direct light reflex, I am going to examine the pupil of the patient. I'll start by mentioning both the pupils are of size 2 to 3 mm, circular in shape and reacting to light. Now I am going to elicit direct light reflex. For this, the background should be dim lit. And we should ask the patient to close the other eye. Please close the other eye like this. Now I am going to elicit the direct light reflex by shining the torch from the temporal side of the eye to the examined. Pupil is now constricting, so direct light reflex is positive in the right eye of the patient. Now I am going to elicit consensual light reflex. Before eliciting consensual light reflex, you should ask the patient to keep your hand on the nasal bridge like this. Keep your hand on the nasal bridge. This will act as an occluder and prevent the light from directly falling on the other eye. You need two torches to elicit consensual light reflex. The other torch should be at the level of the chin. The light should not directly fall on the other eye. Now I am going to shine a torch from the temporal side of the eye to be examined. The other eye is constricting. This means direct and consensual light reflex is positive for the right eye.